My name is Chloe Sutton, and this is my presentation on Huntington's disease. Huntington's disease is a neurodegenerative disorder that causes a progressive breakdown of the nerve cells in the brain, especially damage in the basal ganglia. It affects 1 in 10,000 people in the United States. Huntington's disease has a broad impact on a person's functional abilities and usually results in movement, thinking, and psychiatric disorders. Most people with Huntington's disease develop signs and symptoms in their 20s or 40s, but the onset of the disease may be earlier or later in life. When the disease onset begins before age 20, the condition is called juvenile Huntington's disease. Huntington disease usually causes movement and cognitive disabilities, psychiatric disorders with a wide spectrum of signs and symptoms. Which symptom appears first varies among affected people. During the course of the disease, some disorders appear to be more dominant or have a greater effect on functional ability. The movement disorders associated with Huntington's disease can include both involuntary movements and impairments in voluntary movements. This includes involuntary jerking, muscle problems such as rigidity or muscle contracture, slow or abnormal eye movements, impaired posture and balance, and difficulty with the production of speech or swallowing. The cognitive impairments often associated with Huntington's disease include difficulty in focusing on tasks, lack of flexibility or the tendency to get stuck on a thought, behavior, or action, lack of awareness of one's own behaviors or abilities, slowness in processing thought or finding words, difficulty in learning new information. The most common psychiatric disorder associated with Huntington's disease is depression. Depression appears to occur because of injury to the brain and subsequent changes in brain function. Signs and symptoms include feelings of irritability, social withdrawal, insomnia, fatigue and loss of energy, and frequent thoughts of death. Huntington's disease is caused by an inherited defect in a single gene. Huntington's disease is an autosomal dominant disorder, which means that a person needs only one copy of the defective gene to develop the disorder. With the exception of genes on the sex chromosomes, a person inherits 2 copies of every gene, 1 copy from each parent. A parent with the defective Huntington gene could pass along the defective copy of the gene or the healthy copy. Each child in the family, therefore, has a 50% chance of inheriting the gene that causes the genetic disorder. A diagnosis of Huntington's disease is based on a general physical exam, a review from your family medical history, and a neurological and psychiatric examinations. There are no treatments that can alter the course of Huntington's disease. Drugs to treat some symptoms may include side effects that worsen other symptoms. To care for someone with Huntington's disease, you need to focus on maintaining a safe and structured environment, provide support in daily activities as needed, manage cognitive and behavioral symptoms with a calm approach, encourage social interaction, and seek for professional medical guidance to address specific challenges as the disease progresses.